introducing Dr. Weefling.
Hi, thanks. My name is Dr. Weefling, and I'm the EVP of Physician Network at Rochester Regional Health.
Okay, let's start with Berkeley. Why don't you, if you have a question, go ahead.
Sure. Thanks, Veronica. So I guess the main problem that we're seeing today is that people in phase 1B are able to sign up with the state, but when they're directed to certain providers, the providers say they don't have any vaccine to give them and they can't schedule the time. So can you help us understand and help our viewers understand what the situation is, how people who are 75 and older can schedule an appointment and get that vaccine?
So Rochester Regional Health, we've developed a process that we will be reaching out to our patients who are 75 years and older that have a primary care physician that is either employed by Rochester Regional Health or is part of our GRIPA provider network. That group of patients, we also are including behavioral health provider patients whom the behavioral health provider is the primary caregiver for that patient. But we've created a process where we are generating a randomized list because you're right, there isn't enough vaccine at this point to vaccinate every patient on day one, which we are, just waiting for the day when that happens. As you can imagine, that will be glorious. But because we have a limited vaccine supply, we are doing it in the most fair way that we were able to put together. So anyway, so we'll be reaching out to our patients from a randomized generated list that will allow us to call the patients and speak to them, and with a live body that's going to schedule them into a clinic that works for them.
And when do you see that starting?
We're starting tomorrow.
So the first phone calls that people who are 75 and older should get will be tomorrow?
They'll start rolling today.
And the first shots will be administered when?
Tomorrow. So we got to give them time to get scheduled. And we created drive-through clinics to make it convenient and fast. We did have a community clinic this weekend where we used the drive-through process, and it worked really terrifically. So we will be utilizing that, as well as sites that patients are able to physically walk into for their scheduled vaccine appointment. Dr. Mayer, would you have anything else to add?
Yeah, no, thank you, Berkeley. I think one of the challenges that we're all facing with this exciting and important, next step of the vaccination process is that the number of individuals that will be incorporated in each next rollout of the vaccination process is it gets to be very large numbers, right? So each step gets larger and larger, and so we're doing our utmost to expand our capacity. The entire community is doing the same. And so we just need a few days to get this all rolling. But then even when it's rolling at a high pace, it will still take, a number of, days, if not a number of weeks, to move everyone through the vaccination clinic who wants to be vaccinated.
Yeah, and I think it's a highly complicated process for our elderly patients. And so we tried to create a process that was gentle and really helps them through it.
I have a question. I was on a Zoom call with Dr. Nancy Bennett about an hour and a half ago, and it still sounded like, at least region-wide, it was still going to be a while before people really saw their vaccines, at least people in phase 1B. How many people off the bat do you think will be able to get their vaccine through Rochester Regional?
I don't know, Dr. Mayer, do you want to?
I think that it would ultimately it will be tens of thousands of people. We've already vaccinated over 14,000 people, and there's a significant population in our Finger Lakes region, and we, in partnership with the county and URMC and other health organizations, are committed to getting that vaccine delivered to everyone that wants it. But it is going to take time, of course, and that's over 1.3 million people. And if the majority of them choose to accept the vaccine, it's going to be a lot of folks.
I'm saying it sounds like there's still a supply issue, though.
Well, there may be. I think the part of the challenge is that it's both ramping up all the operations and getting the supply, keeping that all hand in glove, is part of the work. And so we're working through all of that.
Tanner, you have another question?
All right, now I'm sure I'll think of one.
Okay. Noelle?
Hiya. So I know we're talking about the issue of supply. My question is, if there is this delay in getting the supply of vaccines that we need, how is that going to affect people getting their second doses?
We're told it's not supposed to affect second doses at all. And thus far, we've not seen any impact on second doses. We've been able to supply that without interruption. So we expect to continue that.
Okay, I guess I'm a bit confused though, because if we're not getting the supplies that we need, how are we ensuring that those who, their time to get the second dose, that they will get it, especially when you can't mix the different vaccines once you've gotten one?
I guess I'm not exactly sure what you're saying. So the overall supply is being managed so that those who need the second dose will be ensured that they've gotten it. And then the state's releasing more first doses in consideration of the second dose requirements.
Okay. And then I understand, I think it was last week, but I don't have a concept of time anymore, that Rochester Regional Health, you had a vaccine backlog of about 44% of the supply that you had at that time. And I understand from that there has been a heavier burden on Rochester Regional than on URMC of getting vaccines to people in the community. And I'm wondering if there is a concern of this sort of backlog surplus while there are people in this 1B grouping who may have to wait up to 3.5 months, according to Governor Cuomo. So I'm wondering if anything's changing about the distribution to the community now than before, and if so, what that looks like now.
I'd like to clarify what I think that you're saying. Last week, when I was asked what percentage of individuals eligible for the vaccine had received it, I said it was 44%. I'm not aware of a backlog percentage number per se.
I think I'd actually, I'm sorry to interrupt, but I think I recall Veronica assisting me with getting those numbers too, that it was 44% that was still left to be, or that had been administered or had not. I would have to double check that email. But it seemed like there was almost half had not been into the arms of people at that time.
And so by the end of the week, we were up to 69% of all of our eligible individuals. So that percentage moved quickly and day by day as expected and as planned. So now we're continuing to finalize the last of the individuals in 1A that are interested in the vaccine. And then we are advancing into the 1B category groups. So yeah, the vaccine numbers are constantly changing day by day because we get weekly deliveries, and then the anticipated volume of clinics sometimes exceeds what's scheduled, and sometimes is less than what's scheduled. And so we're just we're just tabulating that day by day as we go.
Okay, I'm going to go to Brian. Do you have a question? Brian Quinn? If not, Sean?
Sure, I'll go. Dr. Mayo, you said about 14,000 vaccines you've administered already. I realize that's changing day by day. But do I hear you saying that you feel like you're within a few days of reaching everybody who's eligible in phase 1 who does desire to have the vaccine, that we're very close to that?
Certainly within the Rochester Regional Health System, we're continuing to work with community partners to ensure that all of the um, organizations that are represented there have had their full opportunity to receive the vaccine. And as was in 1A, we were progressing between different groups in 1A, and we will continue to do that. And so starting this 1B group doesn't mean that we're closing the door on 1As or that sort of thing. We're just adding more people as we go, and people may want to take some more time to think about it. Others have already made up their minds, and so all of that has to be factored in. So yeah, I think that as a community we can be pleased with the vaccination rates of our 1A populations, but I do think there's still more to be done there.
Gotcha. And on this group of patients in 1B who are 75 or older who have a relationship with the Rochester Regional Health Network, can you give me a sense for how many people you're going to be reaching out to with phone calls? Or let me rephrase that. How many people fall into that category overall, and how many of those folks can expect to be getting a call this week?
Yeah, right now we're sitting at about 30,000.
Okay. 30,000 is the total population, but how many of those folks are getting...
30,000 of those that are 75 years or older and associated with our PCPs.
Right, but what I'm asking is how many of those people are going to get a call this week? Are you calling everyone, or is that based upon the supply of vaccines that you're receiving?
Yep, it's based on the supply of vaccine that we're receiving, so we'll be doing it in real time, filling up each clinic on a day-by-day basis.
Gotcha. Okay, and no word yet on whether the supply that you're getting is going to change, or what those numbers are going to look like as we move forward?
No, we're expecting probably a couple thousand calls to go out this week, and hopefully as many appointments. But we're not certain, and it depends on how many people are ready to set that appointment and move forward, and how many people want to wait. So we'll just keep moving through this process with, as what Dr. Bridget Weekling said, is a random, computerized random number generator that identifies our patients and reaches out to them.
Okay, thank you very much.
Yeah, the beauty of the process, the way that we've designed it from our perspective, is that it does allow us to be nimble.
Gotcha.
Yeah.
So that we can increase the amount of calls and we can decrease the amount of calls on a dime.
Awesome. Yeah. Okay, thank you.
Thank you, Sean. Howard?
Hello, thank you, Veronica. A few questions. On the 75 and older, I think I read something in the story this morning about doing that group away from a hospital setting. Is that the plan, or how will that be handled?
So we actually, we have chosen sites that are nearby a hospital, because we do want to be prepared in case there is an untoward reaction to the vaccination. So they actually are. They're very close.
And what can you say about that group of people as far as Genesee County? What will be the protocol here?
I'm sorry, I didn't hear your question. It's just a
I'm sorry. I think I had my mic too low. For Genesee County, kind of in that population, what's the plan? What can people 75 and older expect here?
Yep, same process. So we are working through our primary care offices that are associated with Rochester Regional Health, employed and independent, and we are running their patient list through the randomizer using the outbound dialer, and getting those folks scheduled just the same as we're doing in the East and centrally.
A couple more questions specific to Genesee County and UMC. I wanted to find out if there were any issues with distribution here, how it went so far for distribution at UMMC, and related to that, what is the percentage of employees accepting the vaccine versus not, and has that led to any doses being destroyed?
Sure. From my understanding, it's been going quite well in Genesee County. We've had a very good partnership with Mr. Pettit of the Department of Health, who's really helped us reach out to the community groups that are part of 1A, the EMS teams and so forth. So, and the employees and medical staff of the hospital have done a very good job at supporting the community partnerships as well as being vaccinated themselves. Across our health system, we are having about a 70% acceptance rate of the vaccine, so that's a positive number. We hope that will continue to grow, and so we're looking forward to continuing the vaccination process.
Have you been able to distribute all the vaccines available before they, for lack of a better word, expire?
Yeah, so we do need to report to the Department of Health how we're doing with that, and so we report that daily. I can tell you out of the over 18,000 doses we've administered, there's been less than 20 that have had any expiration problems or had to be discarded. So it's a very, very low number. The vaccine's being very well cared for and handled.
Thank you. It sounds like you're doing better than what we're reading about other hospitals.
Thank you, Howard.
Absolutely. And that's part of why we picked some of the sites that we picked, because we also want to be close to a pharmacy with all of the capacity, the freezer capacity and such, to make sure that we're ultimately also protecting the vaccine as much as we're also protecting patients.
That just reminds me of something else. So your freezers with the Pfizer vaccine, is Moderna available here? Will it be available in Genesee County?
Yes, it will be. Yes. The freezer specifications are more rigorous for the Pfizer vaccine because it requires a negative 80 degrees temperature. But the Moderna vaccine still needs to be frozen at negative 20 degrees, and so you need to be sure you have enough freezer volume to manage the supply. And that we have carefully inventoried as well as expanded so that there'll be no freezer limitations in this whole process for our community.
Thank you, Howard. I'm going to go to Leah or Iketa if either one of you have a question.
Hi, yes, Ericetta.
Ooh, little feedback.
Hello?
Whenever you're ready. Yeah, whenever you're ready.
I won't hear them.
Right, but you can hear that.
I have a question, yes.
Go ahead.
As far as vaccine shelf life, any concerns learned from the first time around and then preparations for phase 1B in terms of avoiding a situation where they might have to be thrown out?
I think that the principle of rapid vaccination is important on many counts. And it's certainly most important from an epidemiologic standpoint of controlling the pandemic and from a personal standpoint of protecting individuals. But it also provides us the benefit of we don't need to worry about expiration rates and that sort of thing. And the frozen vaccine does last for a number of months. We are working through the administration much faster than that. So it's really only temporarily frozen while we are thawing batches for the sequential clinics. So we don't have a concern about that exactly.
Do you have a follow-up?
Yeah, I just wanted to follow up as well, non-vaccine related, but ICU capacity for Rochester Regional Health hospitals.
Yes, ICU capacity is an important concern, and we keep a daily eye on that. Our ICUs have expanded their capacity to care for critically ill patients because there is a large number of them. This is more than in non-pandemic times. So at this point in time, I'm grateful that our teams have been able to manage the increased influx of critical patients. We've done that in a number of ways. We have redeployed staff to those areas by expanding both the physician, provider, and nursing staffing categories, as well as a respiratory therapist and others that support those care teams. And we had previously purchased extra equipment, ventilators, and so forth, so we have a sufficient equipment store to manage the needs of the community at this point in time. So we will continue to monitor that, and for the time being, we are managing.
Is there anyone that I missed?
I have another, if that's okay.
I suppose, yes.
Well, I want to ask, I mean, did this switch, I knew we were going to switch to 1B or expand to 1B rather at some point. Did this, I guess, kind of catch people off guard a little bit? I guess what kind of scrambling had to be done over the weekend to really get things ready to go for this week?
So I would say, one of the things that we have been planning, we knew that patients were going to be vaccinated eventually. We hoped sooner than later, especially our vulnerable population. And so we had already mapped out how we were going to be approaching it. It was just a matter of waiting for the guidance that was going to come through from the Department of Health, because as you know, each guidance has been complicated, and so we didn't want to just nail everything down early and risk that things would be changed, and then we would be, starting from scratch. So we mapped out some things, so we felt really prepared. We'd run the clinics, so we knew how we wanted to run them. We prepared staff for those clinics. So we feel lucky. We were pretty on target, I think, to let this be successful this week.
But your point is well taken, Tanner, in that we're all moving through this very quickly. Many times the Department of Health announcements are what's the right word? Are just unknown, or they come unexpectedly. I mean, but that's not quite the right word. I mean, we are expecting announcements, but we just don't know always when they're coming. And so there's a lot moving, and so we're working constantly. We do have people working through the weekends because of our commitment to the community, and we want to be sure that we have all the right things in place. No matter how much we are pre-planning, we are constantly adapting.
Yeah, and I actually can't say that enough. There were many tens of people working on this one particular aspect over the weekend. Starting from 7 o'clock in the morning on Saturday and going last night until 11:30 p.m. Just dedicated individuals that were committed to the cause, committed to making this successful, committed to our patients. I think we're very fortunate. We have a tremendously talented and brilliant staff that I'm honored to work with and call our colleagues. They're there for us.
Thank you guys so much. I
have another question, really quick, if you don't mind.
Make it really quick because they have to get back to patients.
Of course. So regarding the equitable practices of administering vaccines for folks who may not have a doctor, folks who might be poor, how are you ensuring that the way that you are going about this is equitable? I'm curious about that.
So part of the reason that we've chosen some of the locations we've chosen is because of the fact that they are accessible on the bus line and to our critical population that may be impoverished or underserved. So the Reedman Health Center, for instance, is a federally qualified health center that takes care of a very vulnerable population. And so for us, that population is now and has always been an important part of our patient base and who we take care of, and a very important part of our community. And so, as many of you know, that's what I've dedicated my life to, is making sure that we have the access available for our patients who don't have the resources and who need extra support. So we have designed this with that in mind at every step. that's part of the reason we're not just focusing on a technology-only solution, because a technology-only solution would disenfranchise those patients who don't have the luxury of having cell phone minutes and don't have access to internet and Wi-Fi. And that goes for our rural populations as well. We have folks that we've got patients that just don't have those kind of resources in our rural areas as well. So we feel confident in our approach, and we will make adjustments if we're finding that things aren't working.
And then this is Jonathan from Spectrum. I actually didn't get a chance to ask. I know you guys got to go.
This will be the last one.
Okay, I'll make the last one. I'll be pretty concise. I know you guys are right now in starting with 1B. Do you guys have, I guess, a timetable as far as when you'll be able to get through 1B? I know it's just an estimate, of course.
I don't. 1A, sort of the majority of 1A has been accomplished over about 4 to 5 weeks. The 1B populations are a number of times larger than the 1A. And so it's going to take longer than just a few weeks. It's going to take several weeks. And our commitment is to deliver this vaccine as rapidly and as safely as we possibly can. And I'm very reassured, as you have seen throughout this entire pandemic, that the community collaboration has been very meaningful, and we continue to collaborate with all of our partners, and we'll be working on this together.
All right, thank you.
Thank you, everybody. I want to thank the doctors and their tremendous work as always, and thank you guys for participating in this and helping us get the word out. We will have a press release coming out shortly, so any information that you need will probably be found there. If not, you can contact me with any questions. Thank you guys and have a great day.
Thanks, Veronica.
Thank you so much.
Thank you all. Yeah.